Hi, this is Yohei Takada from FuncPhysio Physical Therapy in New York. Today we like to talk about plantar fasciitis. In New York, biggest event in the fall is New York City Marathon. We have a lot of runner clients, and especially this season of the year, right now it's end of the September, we have so many runners coming into our clinic because the runners trying to marathon, and then maybe like before the 1 month they started to increase distance of running, like 15 mile, like 20 mile, that range. Then the body start to break down. Now, most common place of injury is probably like hip, knee, and the foot. And then we'll talk about plantar fasciitis today. Plantar fasciitis is not gonna happen like all of a sudden like this. Especially for runner, it's accumulated stress. Now, there is four risk factors we have already know from the research. Number one, limited dorsiflexion. Tight Achilles cord, calf muscle, and like maybe tight joint that causing a dorsiflexion restriction. That's number one. Two, high BMI, which is kind of overweight. Makes sense, right? Third, standing for a long time during a day. Those are four risk factors we have already known. So if you know like those one of the risk factors you have already have, we have to address it because this is an accumulative event, not one single shot injury. Typical presentation of plantar fasciitis is, of course, heel pain, but not just heel pain. Heel pain happen first in the morning, or if you sit in long time and stand up and this first step, it hurts. And also, touching hurts. In the plantar fasciitis is typical place is the medial aspect of the heel. So if you press in it, it shouldn't hurt, but it hurt. Maybe you have plantar fasciitis or at least some kind of inflammation going on. To treat, its acute inflammation phase is easy, along with like ankle sprain or ligamentous sprain, or pulling muscle. If you manage acute inflammation correctly and follow up with targeting those risk factors, you're completely able to cure. Yet, the most of the time, what problem is accumulative injury. By the time client come to see us, it's really chronic condition. It could be like couple months, a couple years, or even couple decades. The chronic injury is problem because your tissue is static in the spaces, meaning you get repeatedly injured, inflamed, tissue get tighter and harder and prevent circulation, so tissue lose the functionality of healing, and also it become more brittle, like it's kind of easy to break it. So you lose those capacity of healing and then produce healthy tissues. So that accumulation to it. So even though you don't have acute inflammatory response, your pain is there because your tissue is brittle, not the inflammation. So that is chronic condition and that will become problem. Of course, there is a case you need to see orthopedic doctor or podiatrist because like if you're so chronic, maybe you have a calcium deposit and that called a bone spur and that is hitting your tissue. I mean, no way like physical therapist can break down that. So that point, you gotta see like orthopedic doctor, podiatrist to take off surgically that bone spur. But we don't want to get that. So I have two recommendations of how to manage plantar fasciitis. Number one, massage. As I said, chronic condition, tissue get tighter, brittle, cut of the circulation. Use one of like a ball, like for example, lacrosse ball, golf ball, baseball. Put it underneath of your plantar fascia and put the pressure as tolerate you can and gently roll on it. That way, you really break down those like hardened tissues, start to like loosening up, getting a circulation come back, so that promote healthy tissue production. So that's number one thing. Number two, stretch. As you know from the risk factor, limited dose flexion is one of the risk factor. So your calf, Achilles tendon is tight. That's not good. So you gotta stretch out. There is tons of way to stretch Achilles tendon and calf. I mean, you can pick and choose whichever you want. I like this way, and that help lengthening of fascia system. And one other thing is important about stretch. You gotta stretch to all system because the fascia system go around the body, right? So it's important to stretch like hamstring, tissue around the pelvis, tissue around your back. So don't stretch just calf muscle and Achilles tendon. Stretch all your system so that you reduce the tension to your plantar fascia. Try those two things, especially at nighttime. You may feel difference in the morning when you first step. Okay. More importantly, if you feel something off your system, like poking around the plantar area, it's hurting, it shouldn't hurt. Just ask help for a therapist, maybe doctors, so that we can prevent chronic condition. As I said, acute inflammation is easy to manage. Chronic condition is difficult to manage. Try those two exercises. Thank you for listening.